Philippine College of Physicians President Dr. Maricar Limpin got a tongue lashing from presidential spokesperson Roque during a pandemic task force meeting earlier this week. Tell us exactly what happened and her reaction to all of this. We have with us via Zoom Dr. Maricar Limpin. Good afternoon, Doctora. I hope you're doing okay. Most of us only saw the portion of the video of spokesperson Roque, shall we say, losing his cool during the Zoom meeting. Just for context, what was the last thing mentioned which may have caused him to react?
Actually, honestly speaking, I don't know how. What's the reason that prompted that kind of a reaction? The only thing that I did was actually to appeal to the IATF to reconsider placing NCR under GCQ, because we felt that placing NCR under GCQ may even further increase the number of COVID-19 cases. And we stated the facts about the state of healthcare system in the country, and we were saying that it is already overwhelmed by this time, and so yung placing the NCR under GCQ will probably compromise more the healthcare system, which may even lead to the collapse of the healthcare system. Of course, as a healthcare worker, we do not want to see that happening, because in the end, yung mga kababayan natin ang magsasuffer.
I understand that Secretary Roque has since apologized for his behavior, his emotions. And what was your reaction to the spokesperson's outburst? How did this make you feel at the time? And what are your thoughts now?
Yeah, well, of course, with that kind of a reaction, I was surprised, and I think that it's uncalled for, especially since it was made by a public official, no? So I think that if ever there are any reaching out that will be done, no, to government, it should be taken as a means by which we can help government, no, attain the objective of containing this pandemic. So yun yung ano namin. So as I said, no, it is uncalled for. Now, as to the apology or whatever na sinabi ni Secretary Roque, because I also heard that, I think it's I don't personally, no, he should actually apologize, not to me or to my colleague who was also there, si Dr. Tony Dance, no, but he should apologize to the whole of the healthcare workforce, because nandoon po kami as a representative of the healthcare workforce, not for myself.
Right, Doctora, this video has gone viral, and since then, some doctors' groups and medical professionals have called for the resignation of Secretary Roque as well as President Duterte. What are your thoughts on this?
I think, as I said, no, talagang uncalled for, and this is an act, no, that is not expected from a government official. So, personally, I can only speak for myself, and I hope that this will not be taken as anything political, kasi wala po akong any political affiliations, no? So we are here just for the health of the nation. So since it's uncalled for, I think the president should actually remove him from office. It's, you know, the spokesperson kailangan malumanay, no? Hindi dapat yung ganyan ng mga outbursts. Otherwise, parang the spokesperson is the parang representative of the government, no? So parang hindi, it's a disservice to the president yung ginawa ni Secretary Roque.
All right, Doctora, so much for Secretary Roque. For now, let's talk about the government's COVID response. The IATF has just approved the guidelines for the pilot testing of granular lockdowns in NCR, as there will now be just two quarantine classifications, ECQ and GCQ. What are your thoughts on this and the entire scenario in general?
I think we need to, kasi nagbabago sila ng classification, so I think that we need to study and look. No, take a look at the what is the definition of the ECQ and GCQ, and try to look at whether kung ano yon and what the impact will be on the pandemic, no. So personally, no, I have not read yet, no, kung ano yung ibig nilang sabihin by ECQ and GCQ. So I presume that it will be different, the criteria will be different, so I need to study that first before I make any comment.
All right, thank you for your time this afternoon, and do stay safe. That was Dr. Maricar Limpin, Philippine College of Physicians.